When you're working in global mental health at Goldman Sachs, how did it shape your understanding of how different cultures view mental illness? Because you've traveled across all 50 states around the world. How does that view get shaped in your career?
So for the multinational firms that I served, as a consultant, the person that asked this question, very, very insightful. There, there are wide arrays of how people would respond. So, some employers around the globe do not necessarily cover all mental health conditions or any mental health conditions. But I think the most breathtaking response to this is there's now evidence-based medicine that is very effective. That the common the common conditions that we see in the news every single day, opioid use disorder, alcoholism, depression, anxiety, trauma, all of these can effectively be treated through psychotherapy and medications. And so what has happened over the last 20 years is more employers worldwide are now covering these conditions. And I think that the reason that maybe 20 years ago they weren't, and maybe there's still a handful that still aren't today, was it really wasn't understood that mental health conditions, like other chronic health conditions, can be treated. And so now with this scientific approach, more people are coming forward. They're more comfortable sharing that they have a mental health condition and asking for help. And so I think you're right. We do have a long ways to go because there's even people right here in the United States that are still uncomfortable or feel shamed that they have a mental health condition. And when they don't ask for help, they can carry these conditions sometimes for decades, sadly. And so the goal, as you aptly stated, is to destigmatize these mental health conditions. And just like hypertension and heart disease, same thing for mental health. We can and should get treatment, and we just have to find the therapist that we best match to and start those journeys.
That's great.